Welcome to Under the Knife. I'm Dr. Selene Parekh. The Yankees have just announced that CC Sabathia will undergo season-ending surgery for his knee. Earlier this season, he underwent stem cell injections to try to calm down the knee. We have recently learned that this did not really help, and he continues to have knee pain, which does not allow him to pitch. What is going on with his knee? Well, from media reports, in this next surgery, he will have a cleanup done of his knee joint. He may also have a microfracture. Well, microfractures are done for osteochondral defects of the knee. Well, if you think about your knee, it is a smoothly paved road lined by cartilage. Now, that cartilage is meant to allow the two ends of the bone to glide easily on one another. If that smoothly paved road has a pothole, that's your osteochondral defect. The problem with the osteochondral defect is that it can lead to pain, discomfort, popping, clicking, and it can shower many loose pieces which rip up the newly paved road and rip up your knee joint. It can then lead to arthritis. What we don't know is if CC has arthritis, how big his osteochondral defect is, how many he has, and how deep it is in the actual road or in the knee. During his next surgery, the surgeons will plan on going in and cleaning out the knee joint. They are likely to assess that osteochondral defect and then drill holes into the base of it. What they're trying to do is stimulate his body, fill that pothole with blood. After that, there are a few options the surgeons can apply. The first is to just let that pothole fill with blood and hope that it fills in with enough scar tissue that the pothole no longer bothers CC's knee. Alternatively, they can try to fill that pothole with juvenile cartilage. Juvenile cartilage are cells or transplants that are taken from kids who've died. Their cartilage is minced up into little pieces and then put into the pothole. The hope is that the pothole will then fill in with new cartilage. The other option is to take cartilage from other parts of the knee that are not weight-bearing in the knee and put that into the pothole. Either way, CC will undergo extensive physical therapy, extensive rehab, and if he's lucky, the pain will quiet down enough that he will no longer be out of the pitching lineup. The expectation is that he will be able to return to spring training and that he'll be able to pitch. We will have more clarity on this issue once the surgery is performed and we get a better idea of what's going on in the knee itself. But with an osteochondral defect, most patients will have some residual aches and pains. For a pitcher who's landing on the knee and twisting on the knee, this can become problematic. And so this may end up ending his career. We'll only know better once the surgery is performed and we get a better idea from the surgeons about the inside of CC Sabathia's knee. This is Dr. Selene Parekh for Under the Knife.